a medical emergency occurs, what would you do? Imagine these common situations: choking, bleeding, seizure, heart attack, a broken leg or a burn. After all, emergencies can happen anyway, at home, at the supermarket, at work, or at school. How should you react? A warm welcome to the Alice Mackay Show. And today we're going to be talking about medical emergencies with our resident doctor, Vivek Solanki, and Dr. Tinashe Gere. Welcome to the show.
Thank you.
Thank you, Alice.
Right, Doc, what is a medical emergency?
Medical emergencies are those situations which are unforeseen and unplanned for, right? Where suddenly a patient's walking around and collapses, or a patient suddenly is unable to breathe, or gets hit by a car, or falls over, or goes into a coma. Any unforeseen medical situation where you are not able to control yourself is defined as a medical emergency.
And Dr. Gede, what should we do to prepare ourselves in the event that an emergency occurs?
I guess like Dr. Solanki sort of pointed out, medical emergencies occur in different situations. Sometimes it's situations where it's one person involved and the response is slightly different from a situation where I guess there's a mass disaster, bus collides with something else. So the most important is sort of understand the context. If it's a situation where one person's ultimately in a life-threatening situation and you're the first to respond, one of the most important things to recognize that you need to get help. As they say, one swallow doesn't make a summer. So ultimately recognizing that I need more help than myself is very important, and then contacting the right person to provide or deliver that help, whether that's calling the emergency medical service or an ambulance. If you're close by, rushing them to the nearest emergency medical department. In the situation of a sort of disaster situation, say for example there's an outbreak of Ebola and it happens to affect your area, often the government or the local authority will issue very clear guidelines on what you should be if you anticipate you're in a problem. And I think keeping yourself appraised of those guidelines is very important.
Right, and Doc, what sort of information should we give if we require assistance?
Well, important thing the medical fraternity people would want to know is that, did the patient faint? Did they collapse? Or did they get hit by something? Were they bitten by something? Are they on any medication? Did they take an overdose? Accidental poisoning? So these are the various things that the practitioner on the other end of the line will be asking you. And I think the person calling for the emergency should be aware of that and be prepared to answer these questions.
Right.
I think I'll also add is many times I've been in situations where somebody calls in, they're trying to solicit help, and then midway through the conversation the line is cut off and you have no idea where they are, how to deliver help. So one of the most important is identify yourself, identify your location, if possible give a number so that in case something happens they can actually call you back and clarify more. And then beyond that it's what's really going on, or who's affected, and then ultimately what kind of help are you looking for. Because sometimes it can be very hard to figure out how to help the person. Are they looking for an ambulance? Do they need you to tell them some advice on the phone, or do they know where to go to? So I think just having a sense of what help do I need, what's really going on, and importantly, how can people get hold of you should they need to get hold of you in trying to deliver the help. That's very important.
In fact, in that light, we can even advise them, should they need to administer CPR or put the patient on the side or on the side so that they cannot inhale what they are vomiting and things like that, and removing any dangers around the patient.
Right.
You know, all those advice can be given over the phone.
But and Doc, which conditions are life-threatening?
Quite a few, depends now. You know, life-threatening situations, is it acute allergic reaction? Is it accidental or intentional poisoning? Is it an overdose? Is it a heart attack? Is it an asthmatic attack? Have you been stung by a bee or bitten by a snake? Did a car hit you? You know, these are all various aspects of what would be emergencies, yeah?
Right. I think there's some that we as physicians recognize as life-threatening emergencies that people don't always think about. The way to think about it, I guess, is your body has lots of organs. You need to be working all the time to survive. If your kidney suddenly shut down, you wake up, you're unable to pass urine, that can be life-threatening. If your lungs can't work and you can breathe very well, something's wrong with your heart. So anything that potentially puts a major organ at risk could be life-threatening. I think that's important to recognize as well.
Right.
And some of the times it's metabolic problems like poorly controlled diabetes, very high blood pressures. Those also can be potentially life-threatening if uncontrolled.
Or a drunk patient waking up with a severe headache. You know, you might be thinking he's having a stroke.
Yeah, you can definitely mistake that for that. And Dr. Gede, can you render first aid if you're not trained to do so?
I would say yes, with some qualifiers. Now the thing is, when people hear first aid, the thing that immediately pops to their mind is I have to give the patient mouth-to-mouth resuscitation and thump on their chest. In most situations, that's actually not necessary. So the first aid that's very important is getting a very good handle of what's wrong with the patient, what kind of symptom do they have, Often they are very anxious if they are not feeling well, and reassurance makes a big difference. And ultimately, harnessing help, like we said, calling the right people, is things that you can do. Oftentimes, just making sure you can feel and say, do they have a pulse? Are they able to communicate with you? If the person is able to tell you who they are, where they are, and communicate with you, they probably don't need you to be thumping on their chest or breathing into their mouth. The situation where I think it can be very dicey is if the person is totally unresponsive. You try to talk to them, you can't get any response from them. Then in that situation, I think you probably need some basic training. But for the bulk of emergencies, often even your common sense knowledge can be very helpful.
And Doc, when a patient arrives at the hospital, what care do they receive?
Well, again, the medical fraternity or the practitioners will examine, look at the condition of the patient. They measure the blood pressure. Is the patient breathing? Is the patient talking? Are the eyes and pupils reacting? They will ask questions about what happened to the relatives or whoever brings the patient in to assess the overall situation of the patient and condition and treat accordingly.
One of the things we like to do is we like to make it very easy, because like most other humans, sometimes we forget what's important. So you've got what we call the ABCs of life. So is their airway, so their breathing pipe, is it working well? Are they breathing okay? Do they have a pulse? Is their blood pressure fine? So often one of the first things we do when somebody turns up is, in addition to getting some very basic information, we measure what we call their vital signs. What's their blood pressure? What's their heart rate? Is it regular? What's their oxygen level like? And what is their mental status? That can be very good at predicting which patients potentially need emergency help.
What common emergencies do you normally come across at the trauma center?
You find usually pneumonia, malaria, high fevers, people with heart attacks, people with pulmonary edema, some people in renal failure or diabetic comas. These are the more common ones that we get in.
Right.
I'm glad that you mentioned that a lot of the times that when people think of emergencies, they think of, I guess, very esoteric things. Somebody's bitten by a shark, struck by a car. But when you go to an average emergency department, many times it's just extreme worsening of problems that happen very commonly. Poorly treated infections, asthmatics that don't take their medications or get poorly controlled, severely elevated blood pressures, those kinds of problems are probably more common. We do get the occasional, I guess, very hair-raising major traumas and stuff like that.
Where a truck has run over your foot, or you fell off a trampoline, or rugby injuries.
And on that note, we take a break. And when we return, we'll be taking a look at some of the common medical emergencies. Stay tuned, we'll be right back.
Stroke is whereby you have discontinuity of blood flow in your brain, right? It could be a blood clot, or it could be a bleed, or it could be a tumor.
Welcome back. You're still watching the Alice Makaya Show, and we're now in the second segment, and I'm still talking to our resident doctor, Vivek Solanki, and Dr. Tinashe Gede, and we're still on the subject of medical emergencies. And in this segment, we'll be taking a look at some of the common medical emergencies. Doc, difficulty in breathing, what really causes that?
Various causes now. It can be your lungs, it can be your heart, it could be an allergic reaction, it could be an anaphylactic reaction. You could be having some severe illness like a renal failure. So many ailments actually can cause you into having difficulty in breathing.
And I guess there's a lot also added. Sometimes it's, so the commonest thing that people think is something's either wrong with their heart or their lungs. Sometimes it's really sort of an airway problem. If you choke on something, people with sore throats, big tonsils can sometimes kind of impair your ability to breathe. And one of the other things that we sort of find, especially in younger patients, is sometimes extreme anxiety can manifest with just a sensation that you can't breathe at all. So it can be potentially something serious like a bad lung infection, lung disease like blood clots in your lungs.
So even people hyperventilating.
Yes.
You know, anxiety disorders, and then they become hyperventilating. They say we can't breathe, and they have rapid short breathing.
Right. What about allergic reactions?
Allergic reactions also can cause you difficulty in breathing because your airway is getting locked up higher up in the throat and that, and you find it difficult to breathe.
Right, yes. Okay. So if someone is experiencing seizures or convulsions due to an epileptic fit, what precautions should one take to make sure that the patient does not get injured?
So the key thing is to recognize that in the time that the patient is having a seizure, and there's different kinds of them. Sometimes people have very limited, one limb just jerking out a little bit. Some people have what we call generalized tonic-clonic seizures, where they actually lose consciousness for a while and they may have abnormal motor movement. In that situation, they have no ability to protect themselves. And so the person who's around has an obligation to make sure that there's nothing injurious around. Often lying them on the side, if you can position them all, helps them avoid, because one of the problems, sometimes they swallow things the wrong way, what we call aspiration, and that can lead to really bad lung injury. So making sure there's nothing around them that's sharp and potentially injurious, making sure they're positioned appropriately, and then trying to get a sense of what's really seizing. So is it one limb, is it one side of the body, is it everything, and possibly getting a sense of what the time period is. That can be very helpful, especially if you have called an ambulance or called a doctor to kind of provide help. They want to know that kind of information.
Also, I suppose, knowing whether this has happened before or not, so if it's with family members, the patient may have had these seizures before, so they know that it may be self-limiting or so, and they'll also realize if it's not self-limiting, it's carrying on, then it's time to get to an emergency facility.
Right, Doc, what is a stroke and what causes it?
There are many reasons for getting a stroke. A stroke is whereby you have discontinuity of blood flow in your brain, right? It could be a blood clot, or it could be a bleed, or it could be a tumor, right? Any of these factors could cause a stroke.
Okay. And then the way it usually manifests is, we typically think of a stroke if you've got sudden onset of loss of neurologic function. So some part of your body, which is controlled by the brain, is unable to work because the brain's not working. It can be slurring of speech, so you're suddenly unable to make very useful words. Facial asymmetry, people typically think of, especially in the African context, if somebody's mouth seems a bit asymmetrical, there's all thoughts about, or maybe somebody did a bad thing, witchcraft, but usually strokes manifest the same way. And then I think weakness in one limb or another, often it's one side, so the right side's not working or the left side's not working. Those are typical signs of a stroke. Sometimes they can be very subtle. It can manifest with very mild confusion or brief loss of consciousness. So any part of the brain, if it's affected and can't get good blood flow, will manifest with some kind of symptom, either a speech problem, confusion, or weakness in one part or another.
And Doc, what causes a heart attack?
Again, heart attack is similar to a stroke, isn't it? I mean, you find that the blood vessels in the heart get blocked, right? Through a clot, a blood clot, or it could be a cholesterol plaque. It could be any of those things. The important thing is, what are the signs of a heart attack, right? In men, usually you find that they get this crushing central chest pain. It could be radiating down the arm or up the chin. They get cold and clammy and sweaty. It's common after a big meal as well. And again, important to note is that in women, the symptoms are different, right? They may just complain of indigestion or a stomach ache or just feeling unwell or feeling down. And one has to be aware of that there's differences in that.
I think in addition to recognizing sort of what symptoms people can present with, I think it's very helpful is to know what kind of people get them. Usually heart attacks are very unusual in children or young adults. Its age is important. There's diseases that we know that can increase your risk of vascular problems: hypertension, diabetes, heavy smoking, sedentary lifestyle. So if somebody with the right kind of risk factors suddenly starts developing either chest pain, discomfort, even what feels like dyspepsia, like you're rightly saying, those patients should consider getting a checkup for possibly a cardiac event, because it can be very subtle in its initial presentation.
But these days we're also getting these young people with obesity, coming presenting. They've got high blood pressure, they've got type 2 diabetes already, and they are 25 to 30-year-olds, and they are early candidates for heart attacks.
Right, and how do you treat, injuries such as a broken leg or perhaps a dental injuries?
Well, first of all, I think with the broken bones and that, it depends where. If you're out there, you are not near an emergency facility, those people around you, they should help you to splint your bone. If there's an obvious break or a bend or something like that, splint that limb and bandage it and get them to the nearest medical facility. If you've got some painkillers or so, paracetamol, anything simple, give it to them, right? And then if it's any other type of emergency and that, I think you have to just see if you can manage it. If you can't, rush to the nearest medical facility or call an ambulance. Sometimes ambulances take a while to get there, so I always advise patients, get into the car, get to the nearest facilities. And we have so many emergency facilities these days, especially in the cities, and that I think you can get to the nearest one within 5-10 minutes.
And the one group that I'll probably say is important to consider separately is people with head injury. So they've had some kind of trauma, they potentially bumped their head or something struck them on the head, especially neck injury. The main thing to remember is that you can potentially make things worse if you try and over-move them. So you often see people put cervical collars. You could use cardboard boxes, just make sure that you don't over-manipulate them.
The thing is not to move the person.
So if they have potential head or neck injury, those ones, if you're going to move, make sure it's kept still, it's very controlled, and have the ambulance crew move it. But if it's peripheral, somebody crushed their foot, those ones you can probably split up and take to the hospital with no problems.
I've often heard that if somebody's got like an ankle injury, that they can soak their foot in hot water. Is that advisable?
Well, the exact opposite actually. We say, use cold compress, ice packs, things that will help with the inflammation and that, and to ascertain the degree of the damage. It could be just a sprain or it could be a fracture. But giving them a few painkillers, analgesia and ice packs, 20 minutes every 4 hours would be the right thing to do. If the pain persists beyond that, I think then you have to bring them into an emergency facility.
Okay, because a lot of people, I think, make the mistake of saying, soak it in hot water.
So it makes them feel better, that's for sure, in the short term, but the swelling tends to get worse because warmth actually drives more swelling.
All right. And on that note, we take a break. And when we return, we're looking at pediatric medical emergencies. Stay tuned. You don't want to miss this.
Mothers often have a very good instinct for these things. If the mom feels like, or the caregiver feels like the child's not really right, often that's very predictive of something potentially serious going on. Especially for first mothers, they don't really know. And it's never a bad idea to err on the side of caution. Children can get sick very, very quickly.
Welcome back. We're still watching the Alice Mackay Show, and we're still on the subject of medical emergencies. And I'm still talking to Dr. Vivek Solanki and Dr. Tinashe Gede. And in this segment, we'll be taking a look at pediatric medical emergencies. So, Doc, which age group falls under pediatric emergencies?
Classically, we say anybody under the age of 17, 18, they are pediatrics, under pediatrics. But then you find 12-year-olds today, who are bigger than adults. So and that's where physicians come in. In fact, we actually, on a large 13-year-old child, would call the physician in to say, help here.
Right. And what are the common pediatric emergencies that you come across?
I think they're very variable depending on the age of the child. One of the things that I think parents complain a lot about is children with sore throats, children with fevers that don't seem to be able to, that don't go away, acute stomach pain or abdominal pain in young children. Those are probably the most common, and then acute asthmatic attacks as well. There's a lot of injuries. Children will be children, they go around, they play, they touch things they shouldn't touch, so small little burns, injuries in young children.
Also bites, they're very common to get tick bites or spider bites. You find that they get bitten by spiders in the bed and what have you. They wake up in the morning, the arm is big, the mother's panic, child's got a fever. So all these kind of things that come in.
So when should parents seek medical attention?
So I think by and large, if you've got persistent high fever, the child is not eating, they've got severe diarrhea or difficulty in breathing, these are the situations where I think you go to take the child in for further investigation.
Mothers often have a very good instinct for these things. If the mom feels like, or the caregiver feels like the child's not really right, often that's very predictive of something potentially serious going on. Especially for first mothers, they don't really know. And it's never a bad idea to err on the side of caution. Children can get sick very, very quickly. So if they suddenly feel unwell and you're just not happy with your condition, it's not a bad idea to either get in touch with your pediatrician, go to the nearest clinic, or go to the emergency department for an evaluation.
Especially with the newborns, newborns with the mothers and that, I think, don't take a chance. Get to the emergency department.
Right, and we know that fevers are so common. How do you treat a fever?
Well, the common thing is, of course, we use antipyretics, like simple things like paracetamol or aspirin, or we usually say tepid sponging, remove the clothes of the child, you put them in a cool bath or a tepid sponge bath and drop the temperature. That's the quickest way to do so. But if you find that the temperature is persisting, and you are panicking and that, I think get to the nearest medical facilities. Or if you can get hold of a pediatrician, perhaps he can reassure you as well and give you correct advice over the phone on what to do.
I think you're right in saying that it's very common for children to have fevers. The time that I would say is probably not very worrisome is if you've got a good reason for that happening. So they've got a sore throat, they have a runny nose, and they kind of have a bit of a low-grade fever that you can probably cope with at home with relatively simple interventions. I think if a child has fever plus something else, they suddenly can't feed, they're not breathing well, or they look like they're a little bit more confused than usual, those ones I think are serious enough that I would say you should definitely make sure that they get evaluated by either their pediatrician or by emergency department.
Or if they're crying a lot, you've been to a malaria area, then you know that fever is not normal. It's an abnormal type of fever with the history of where you've been at that, so one has to be cautious on that, yes.
Right, and if a child is choking, what assistance can you offer that child?
Depending on the age of the child, so if it's a baby, you can turn the baby upside down, smack it at the back, put your fingers in to empty out and see if there's any foreign body or food particles or anything in their mouth. And a little bit older children, again, you can smack them at the back, ask them if they swallowed anything, and see whether they're breathing or not. Is it affecting the airway? Is it blocking it? And so it's various things that one does, yes.
It's amazing how, especially with little children, they mouth things, especially when they're like 1 to 2, they start crawling, they pick everything up and put it in their mouth. So if if you are not sure what they might have taken, and small simple interventions don't seem to work, sometimes doctors actually have to go in with a special camera and try and kind of dig out some of these objects that children may try to swallow that don't go down very well.
Also, one danger of this is, these small batteries, they are, I tell you, life-threatening. So, a lot of toys, cell phones, a lot of these things have these little round batteries, right?
Yeah.
And if the kids end up having that and they swallow that, it can actually rupture through their abdomen, either through their stomach. And
what impact will that have on the body?
Child dies.
Jeez.
Yeah, the child dies. I mean, we've seen that, and so we always caution parents to say, do not keep these little round batteries around where a child can get hold of it.
And I think you've made a very important point. In addition to sort of, I guess, toys or instruments, children always touch whatever is within reach. So making sure you keep chemicals, potential poisons out of the reach of children is very, very important.
Right, and talking about poisons, if a child swallows a poisonous substance, what should we not do?
Well, first of all, identify what they've swallowed. You can see immediately what they might have swallowed or not. If it's paraffin or petroleum type of things, do not give them anything through their mouth and do not induce vomiting at all. That is very important, because if they do that, they can inhale it into their lungs and cause even bigger problems. A lot of people like to give them milk and things to drink. We say,
Even water.
Or even water. Rush to the emergency center and let them deal with it, because if you give them too much water or too much milk as well, they could vomit as well and make matters worse.
Okay, because a lot of people think that milk actually neutralizes the poison.
Well, milk could neutralize a lot of poisons, yes, but you have to know what poison the child has taken, And if you take too much milk and it induces vomiting, and the child is feeling sick anyway, they've swallowed some poisonous substance, they are bound to vomit whatever they put in. And I think it has to be in a controlled environment.
Right.
Yeah, and I think the key thing is to recognize that how much they took, what exactly they took, and when they actually took it matters. So if they took it a day ago, that's very different from somebody who's just freshly ingested something. I think the most important is just to gather as much information as possible. How much might they have taken? What did they take? And probably carry the bottle along with you and get to the emergency department. A lot of the things, thankfully, that children sometimes ingest, like household detergents and stuff, may not be as fatal or lethal as a panicked mom thinks it is in the situation. But many times you don't want to take chances, and you want to make sure that the right person is able to make that decision.
Right. And what about allergic reactions? Because I know a lot of kids react to food or even maybe a bee sting.
So allergic reactions can be varied. It can be from a bee sting, it can be from peanuts, it can be from fish. It depends on various allergens that the person is allergic to. You would have to be exposed a couple of times for it to become dangerous, right? Because your immune system starts reacting each time you get bitten or you expose yourself to the allergen. So that is one thing. So if the parents know that my child is allergic to any of these substances, and the reaction starts getting out of hand, so it goes beyond just a red patch, and that they start having swelling of their lips, and they got these red patches all over their body, temperature starts going up, they start crying, they start to have rapid breathing or difficulty in breathing, or they say, well, Mom, I can't swallow, or something. Rush to the nearest medical facility.
Many times we have a couple of things. There are specific antidotes for like bee sting, antivenom, the antidote that you can have. And we have got a special medication called adrenaline, which is usually able to help in those situations where there's severe life-threatening allergy. I have to say, if you look at it sort of on a global scale, things like peanut allergy are increasingly recognized as things that potentially could be fatal. Yes. And I think bee stings in sensitized people are extremely important. There's lots of allergy type complaints where they say, oh, my child's allergic to this. If it's just kind of a bit of vague abdominal pain, a bit of a mild skin rash, those ones are generally easily managed and sometimes don't even require medical intervention. Yes. But I think the major ones that affect breathing or somebody becomes very sick, those ones you have to make sure that you get to the emergency department.
Yes. Right. And Doc, your general advice on medical emergencies?
I think, first of all, don't panic, right? Identify what the emergency is. Have the numbers available of your nearest medical facilities, ambulance services, the police. Have that handy in your phone, on your fridge, near your telephones or anything like that. And be alert to recognize the problem and call for help.
And Dr. Kere?
I think that is very important. I think the other thing that I would emphasize again is there are very few true emergencies where you can solve the problem alone. So whether that's getting to an emergency department, getting a neighbor over, many times having some help will help you make better decisions. And the key thing is don't panic. It seems like people are dying when things start going wrong, but you probably have a bit more time than a few seconds to kind of figure out and get the right kind of intervention.
All right. Well, thank you so much for coming through to the Alice Makaya Show. And there I was talking to Dr. Vivek Solanki and Dr. Tinashe Gere about medical emergencies. And as you heard, they said, keep emergency numbers close by and do not panic in an emergency situation. Well, thank you for watching the Alice Makaya Show. And if you do have any questions, do get in touch with us on the contact details that are on the screen. Take care and goodbye.